Okay, PFRANKMD fans, we are going to talk today about lip revision. About 10% of my practice is actually doing revisional work with injectables and body sculpting and things of that nature. And understandably, there are a lot of misconceptions about how to use fillers, what to use, how to go about it. All faces and features are not created equal. We have a beautiful young lady here today who had done lip augmentation actually several years ago. And she's felt over time the filler has migrated. There's a lot of talk about migration. Lip augmentation is very, very popular now, but what people don't realize is that all lips are not created equal. You cannot get the same shape in everyone. What you have to do is you have to have a provider who's going to maximize what you have. Sometimes you can create some elaboration on God's theme, so to speak, but you can't stuff too much sausage in the wrapping, so to speak. Because what happens is, as you kiss, as you eat, as you talk, over whether it's immediate or over a long-term process, the filler is going to shift. And for someone who's really looking for a change in shape of a lip, you really can't do it all in one sitting. I have many patients with very thin lips that are actually looking to get significant volume enhancement, and we'll do very small amounts week by week. You have to look at what's been given to the person. You want to see what your achievements are. You have to get realistic expectations. So again, lovely, beautiful young woman, but really doesn't like the way the filler shape is here. The filler was placed too aggressively, and from chronic smiling, it really just shifted out to the rim here, and it really just gives a very full look. Now, if you look on Instagram, it appears that a lot of people may like this look, but over the long term, what it's doing is just stretching and distorting the skin to the point where ultimately you get filler burnout. You can get it on any feature, on the cheeks, on the lips, on the jawline, and it really is essential to know the amounts you're using and not only what you're using, but how you're using it. Different hyaluronic acid fillers react differently. Some retain more water in situations where you want. Some are harder and leave more lumps and bumps. So you really have to have this discussion with your provider. What I'm going to do here is do some reparative work. Now I know she still wants nice full lips, but first we have to clean slate. So I'm going to use Hyaluronidase. There are a few different brands on the market, but what I have to do is kind of flush it out a little bit. It's rare. Sometimes you can add and subtract at the same time. I think because it's been like this for a few years now, maybe she also doesn't know exactly what's in the lip. Certain products like Juvederm ones are harder to melt, and it can often necessitate melting the filler in a few sessions. So first I want to get the bulk of it down, and I'm actually going to use a fine, she's a little superficially anesthetized, and I'm going to use a fine cannula because melting can be traumatic. The actual melting process of the filler can be bruising and cause inflammation. So I want to minimize the amount of pokes I do. So I'm going to come in from the side, okay, and what I'm going to do is I'm going to go in through the hole, a push, good. And it's going to sting a little bit. And what I'm doing is I'm able to go exactly with the cannula where I want to melt here. Good. Now, we do want to massage the area, okay? It takes about, sometimes we see some difference right away. There's definitely softening right away. But I say it takes really 24 hours to see a difference. I will not re-inject for at least 3 to 5 days, really, to see what's necessary. Now, the longer the filler's been there, sometimes the longer it could take to remove it. And there's also this concern of deflated tissue. The skin can look a little crepey and empty. The good news is, particularly in young people, after a few days, it retracts. It's not going to stay that way. So people get fearful that they're going to look hyper deflated and the skin is going to look loose, but that's not really necessarily the case. The other major concern that most people have, if you go on the internet, is the melting or causing atrophy of the natural tissue in their face. And the fact of the matter is, Hyaluronidase melts natural and unnatural filler hyaluronic acid. Hyaluronic acid is a polysaccharide sugar that's found in the skin. And yes, our body makes it all the time. So even if you dissolve some of the natural hyaluronic acid, your body's going to make it back in a week. Hyaluronidase, the enzyme we're using, does not melt collagen. it does not melt fat. And there have actually been studies done to show that using the melting substance is not going to cause facial wasting. If you go on the internet, there are case studies, there are people very concerned, they tried small amounts of it and they look like they lost 20 pounds. It's really not the case. In fact, when we are in emergency situations where someone has an allergy or someone has a vascular crisis, the filler gets in the blood vessel, we use sometimes 100 times the dose to reverse the filler. And, again, I do 10% of my entire practice. I inject 30 patients a day. I do a lot of reparative work. I've never really seen someone who has lost dramatic volume of the face. So anything is possible, but enough data and enough use of the product has been around that we really haven't seen it. So melting filler is very safe. In fact, I think it's safer to melt the filler and get rid of it than the consequences of leaving bad filler in the face. You're gonna feel a little push, okay? Again, the advantage here of me using a cannula is resisting having to give her multiple punctures because no one wants purple lips. Listing a little bit going in.
It hurts nowhere near.
Really? Okay. You know what hurts? Stuffing too much filler in a lip at one time. Again, what you want to do if you want significant volume in the lips in someone with thin lips is to do it slowly. I have patients that I'll see once a week to add the filler until you get it right. It's kind of like a tissue expansion. Okay, open your mouth. Now, you guys, you're not seeing much difference now because obviously there's fluid. But in 24 hours, it's going to dramatically reduce. I'm going to give her a little dose of anti-inflammatory. And then probably in about 3 days, I will, close your mouth, good. Probably in about 3 days, I'll consider re-injection. Sometimes we get lucky and there's an art to reducing filler as much as there is into inducing filler. And sometimes whether it's under the eye or in the cheekbones, you can reduce it partially. You can bring it down because some people, they still want the filler. They just don't want it, exaggerating their features. So if we can melt it down a certain percentage and sculpt it down, the patient won't have to go and spend the money to refill the whole area because it's expensive. Hyaluronidase is not a cheap substance to do. There's an art to doing it. It's very rare someone has any issues with it. It really doesn't cause allergic reactions. And I think there's as much of a skill in reducing it and managing the aesthetics of poor filler than there is in doing its very start. You did amazing. We're going to keep you on brand and we're going to keep her lips full. She wants that. We just want natural looking volumized lips. So right here at PFRANKMD. See you later.